You know, if you're a guy who wants to take charge of your prostate health, you got to learn how to read your body's signals. Prostate issues aren't just about age. It's about living habits. As a urologist who's been dealing with men's health concerns for decades, I've seen it all. So, listen up. One thing that drives prostate issues crazy, a lot of guys think it's all in their head, but let me tell you, it's real, and it hurts. We're talking pain in the lower pelvic area, the back, the hips, the thighs, maybe even down the testicles. It can feel like a sharp stabbing or a dull ache. And it's not just a one-off thing. It comes and goes, hangs around for months. You might even get a fever and chills along with it. Now, prostatitis is different from BPH, which is about pee problems. This is pain down under. For a long time, doctors didn't know much about it. They called it chronic pelvic pain. But in 2018, research found out it was actually prostatitis, inflammation of the prostate. And the kicker, they're still trying to figure out what causes it. The problem is, a lot of guys suffer in silence. They think it's all in their heads, or just part of getting older. But that's not the case. Untreated prostatitis can lead to complications like abscesses, urinary tract infections, and even issues with your kidneys. Now, did you know that bacteria is a main cause of prostatitis? Yep, the same bugs that cause bladder infections or kidney issues can show up in the prostate. And while it's possible to test for these bacteria in a urine sample, sometimes that's not enough. That's why doctors like me perform prostate exams. It's a quick procedure where we insert a finger into the rectum to feel the prostate for any signs of inflammation or abnormalities. Believe me, it's not pleasant, but it's important for knowing what's going on. So, do you want be afraid to ask your doctor for an exam if you suspect you might have prostatitis? It's key to getting the right treatment. And remember, antibiotics are only helpful when there's a bacterial infection involved. If it's another type of prostatitis, antibiotics won't do much. There's also chronic prostatitis, a condition where guys have symptoms of prostatitis for over 3 months, but they don't show signs of infection. Research suggests it could be related to issues like pain processing, depression, or other health conditions, like irritable bowel syndrome. Guys suffering from chronic prostatitis might experience muscle tension, sleep problems, fatigue, and a range of other uncomfortable symptoms. So if you're dealing with persistent pelvic pain, don't hesitate to seek help. But let us shift gears a bit and talk about something a lot of us deal with as we age: enlarged prostate. You see, as men get older, especially past 50, many start dealing with this condition. It's super common. In fact, half of all men over 60 have it. And by the age of 80, that number jumps to 80%. So yeah, it's widespread. And for those who haven't heard about it, an enlarged prostate can make peeing pretty challenging. Imagine trying to pee through a narrow tube. It's not easy, is it? And that's exactly what guys with an enlarged prostate go through. This condition can make it hard to empty your bladder completely. You might find yourself dribbling or straining to pee, or you might take a while to get the stream going. And those nighttime trips to the bathroom, yeah, they can be more frequent, too. And here's the thing: an enlarged prostate can be a gateway to other issues. If left untreated, it can raise your risk of getting kidney infections, bladder problems, or even block the flow of urine, leading to serious complications. But before you jump to conclusions, I want to tell you this: enlarged prostate doesn't automatically mean cancer. Those are two separate issues. Having an enlarged prostate is like having a traffic jam down under. Just like traffic can slow you down, an enlarged prostate can make your pee flow sluggish. However, unlike traffic, which eventually clears, an enlarged prostate needs some help to shrink back to its normal size. Now let's talk about something that can make an enlarged prostate worse. That's right, prostate massages. Here's the deal. Doctors used to recommend them a lot, thinking it would help with an enlarged prostate. But guess what? It turns out that prostate massages don't do much to fix the actual problem. The idea behind them is to squeeze the prostate to get rid of extra fluid, but it's not a long-term solution. And there's no evidence showing they help prevent prostate cancer either. Plus, they can be painful and might even cause rectal bleeding. So, unless your doctor recommends them as part of a treatment plan, skip the prostate massages. So how do you actually tackle an enlarged prostate? Well, there are medications that can help relax the prostate muscles or reduce fluid buildup. And in some cases, doctors might suggest a surgical procedure called a prostate biopsy. Now, don't panic. A biopsy is only necessary if there are signs of cancer. If it's just an enlarged prostate, a biopsy is not needed. There's also this popular supplement called saw palmetto. It's a herbal remedy that many people turn to for prostate health. But here's what you need to know. While some studies have shown that it can improve urinary symptoms related to an enlarged prostate, others haven't been so sure about its benefits. The U.S. Food and Drug Administration hasn't approved saw palmetto as a treatment for an enlarged prostate, so keep that in mind. And remember, just because something is sold as a supplement doesn't mean it's safe or effective. So what's the bottom line here? Well, for one, don't ignore symptoms like trouble urinating or frequent bathroom trips. It's crucial to get checked out. Early detection and treatment can prevent more significant issues down the road. Secondly, adopt healthier habits like eating a balanced diet, staying active, and managing stress. These are fundamental to maintaining good prostate health. Lastly, stay informed. Learn about your prostate and what you can do to keep it healthy. So if you have questions, talk to your doctor or consult reliable sources like the American Urological Association. Remember, taking care of your prostate is a proactive journey. Make it a priority and watch out for any signs that might pop up. Stay healthy and keep moving forward. Hi, I hope you found that useful. And if you want to know more about natural methods to enhance your prostate health, stay tuned. And always remember, better health is just a choice away. Thanks for watching. Have you ever found yourself caught off guard, needing to use the restroom but dreading the moment you step onto the porcelain throne? For many men, this common experience isn't just an embarrassing anecdote. It's a symptom of a more serious issue lurking beneath the surface, an enlarged prostate. But here's the twist. One of the biggest contributors to this condition might be hiding in plain sight, disguised as a daily habit. And what's worse, it's something you probably think is entirely harmless. Especially this one. Don't let sitting become the quiet force that enlarges your prostate, while you're not even looking. Your body is talking to you. It's time to listen and it's time to move. Now let us talk about something that might hit a little closer to home and what's on your plate. As a doctor who sees men struggling with prostate issues every single day, I can tell you this without hesitation. What you eat plays a powerful role in the health of your prostate. In fact, there's one habit, one daily routine, that's become almost second nature for so many seniors, and it's slowly feeding the problem. That habit is the regular consumption of processed foods. I'm talking about the frozen dinners, the salty snacks, the deli meats, the fast food meals, and the endless parade of prepackaged, shelf-stable products that fill up most pantries. It's convenient, I know. It saves time. It tastes good. And for many seniors living alone or dealing with limited mobility, it feels like a practical solution. But here est what many people don't realize. Those same convenient foods are often loaded with unhealthy fats, sodium, sugars, and artificial additives, all of which stir up inflammation inside the body, especially in delicate organs like the prostate. Your prostate is a gland that's highly sensitive to hormonal changes and inflammation. When your diet is full of processed meats like bacon, sausages, and cold-cut refined carbs like white bread, sugary pastries, and sweetened drinks, you're feeding inflammation on a daily basis. You're triggering the body's internal alarm system over and over again. And chronic inflammation is one of the key factors behind benign prostatic hyperplasia, or BPHD, medical term for non-cancerous prostate enlargement. Here's something else that happens. These types of foods promote a hormonal environment that's unbalanced. High intake of saturated fats and simple sugars can lead to increased levels of insulin and insulin-like growth factors in the body. That, in turn, affects how your body manages testosterone and a more potent form of it called dihydrotestosterone. Now, DHT plays a direct role in making the prostate grow. So when your hormones are out of balance because of poor diet, your prostate becomes even more vulnerable. I've had countless men sit in my office and tell me they understand why their symptoms are getting worse, why they're running to the bathroom constantly, why their stream is weak, why they never feel completely emptied. And once we dig into their daily diet, it becomes clear. Breakfast, sausage and white toast. Lunch, a ham sandwich with chips. Dinner, maybe a frozen pizza. Cookies, sodas, or salty crackers. When that kind of eating pattern becomes a habit, it's not just adding pounds to the waistline, it's swelling the prostate from the inside out. And I get it. These foods are everywhere. They're affordable, accessible, and they give you that immediate satisfaction. But over time, they chip away at your health. Silently, they build up excess body fat, especially around the abdomen, which doesn't just sit there. Fat tissue, particularly visceral fat, is metabolically active. It produces estrogen-like hormones that throw off your testosterone balance and promote even more prostate growth. It's not just about what processed foods contain, it's also about what they're lacking. They're low in fiber, antioxidants, and key nutrients like zinc and vitamin E that support prostate health. You're missing out on the protective power of whole foods. Think about how many meals go by without a fresh vegetable, or a serving of legumes, or whole grains. Over time, those missing nutrients create deficiencies, and your body, especially your prostate, starts to suffer. But let me be clear, this isn't about making you feel guilty. It's about helping you connect the dots. The truth is, every bite you take sends a message to your body. And when that message is filled with salt, trans fats, sugar, and preservatives, the body responds in kind, with inflammation, with hormone imbalance, with organ stress. And let me leave you with this. The food industry doesn't care about your prostate. Those bright labels and microwavable trays weren't designed with your long-term health in mind. But you can care. You can take back that power. You can begin replacing the very habits that are fueling prostate problems one plate at a time. Because the truth is, what you eat either fights for your health or feeds the very issues you're trying to escape. Now, you might be wondering, what if I could change my diet? Would it really make a difference? Absolutely. In fact, studies have shown that making dietary changes can slow down the progression of prostate enlargement. So a well-balanced diet rich in fruits, vegetables, and whole grains can help manage symptoms and improve your overall health. If you want to learn more about the best foods for your prostate health, check out this video. Next, let's move on to another habit that can indirectly contribute to prostate enlargement, something most guys do regularly without giving it a second thought. It's staying seated for extended periods, whether at a desk, in a car, or watching TV. Now, before you dismiss this as an innocent activity, consider this: prolonged sitting can cause blood to pool in the pelvic region, including the prostate area. This can result in swelling and congestion, potentially contributing to prostate enlargement. Furthermore, staying seated limits movement, reducing the amount of prostate-specific antigen, or PSA, produced by your prostate. A healthy PSA level helps keep the prostate working correctly. Sitting for long stretches can disrupt this balance, potentially leading to additional enlargement. Let me share an example. Imagine you're driving for hours without a break. The blood in your legs pools, becoming heavier and more concentrated. When you stand up, that blood rushes to your lower body, putting pressure on the veins. It becomes harder for blood to return to your heart. The result is that extra blood stays in your pelvis, potentially adding to prostate swelling. Sitting for long periods can trigger a similar effect. Instead of being on your feet, your body is more likely to send a significant portion of blood to your legs and other areas, leaving less blood for the prostate and pelvic regions. This reduced blood flow can affect the prostate's ability to drain efficiently, leading to symptoms like frequent urination and incomplete bladder emptying. It's like having a partially clogged drain. The flow becomes slower and more difficult. Prolonged sitting also tends to limit the amount of exercise you get, and exercise isn't just good for your heart and lungs. It benefits your prostate as well. Regular physical activity can help maintain a healthy prostate by improving blood circulation, promoting hormonal balance, and reducing stress. Conversely, a sedentary lifestyle with minimal movement can contribute to stagnation. This can increase the likelihood of prostate issues such as enlargement or inflammation. Think about the average American male. How much time do you spend sitting at a desk job, in traffic, on the couch, hours upon hours? This isn't just a passing trend or fad. This is a deeply ingrained habit in our society, and it's not always easy to change. It might seem like a minor part of your daily routine, but sitting for long periods can have consequences. If you're used to a more sedentary lifestyle, your body needs to adapt to the sudden change. When you switch from sitting to standing, you put more demand on your cardiovascular system. Initially, you may experience some discomfort or fatigue. That's why it's important to gradually ease into these changes. Start by standing up every 20 minutes or so. Stretch your legs, walk around your office or home. It may feel awkward at first, but it will help improve blood flow and reduce the pooling of blood in your lower body. Remember, small, consistent steps lead to big changes. If you find yourself sitting for long stretches, especially in situations like commuting or watching TV, set reminders on your phone to get up and move. Even just a minute of movement every half hour can make a difference. If you enjoyed this video and want to dive deeper into the topic, make sure to subscribe to our channel for more informative content. See you next time.